Doctor since I was born. Good morning or good afternoon. I am with Dr. Nelson Vazquez, and he has been practicing for the last 40 years. We were just talking about that right before we started. And I'm so happy that we hooked up today, Dr. Nelson.
Thanks for having me here.
Yeah, you're welcome. I wanted to talk about a little bit like what inspired you to become a family physician?
Well, sometimes, just as a little preamble, sometimes it's difficult for me to identify with people who are a senior in high school, for example, and
Yeah,
they still have no idea what they're gonna do.
right.
Uh, so I try to understand them. I've gone through three kids that went past those ages, but I I made my decision to be a doctor probably before or around the age of 3.
Oh,
Uh,
oh wow. That's awesome.
uh, I had a brother older than me a couple of years, and he suffered from epileptic seizures
Oh wow.
and also had some mental retardation. And I used to tell him I was going to be a doctor to cure him.
Oh,
So that always stuck with me. My first graduation, we had a play. I was
okay.
in a multi-grade little church school,
Yeah.
and I played. Uh, it was a two-person little play
Yeah.
with a girl that was born the same day as me. As a matter of fact, I call her my twin from another mother because same day this world we came to be. But I played a doctor when
Oh,
I was 5 years
interesting.
old. I was, but yeah, I've always thought I was going to be a doctor. As growing up, there were other things. I always saw the same pediatrician from the age I remember until he kicked me out of his practice, probably at 21 or something like that. Uh, Now, of course, I grew up in the 60s. So when I went to
Okay.
see my pediatrician, he was smoking.
Sure. Camels and Marlboros.
And then my mother was a nurse.
Oh, okay.
My father was an army medic. So, you know, I was definitely encouraged
Sure.
always to pursue that. But it was my decision. It was as early as I can remember in life.
Oh, wow. That's awesome. I believe that people have a basic purpose and they understand that at like two or three what they want to accomplish in their life. So it makes sense. Um, So you do keto and you do carnivore. Do you want to go into a little bit like what that's done for you? And then afterwards, I'm curious like how that has changed your physicianing, if that's a right way to say it, how you're doctoring now.
So uh, I've been aware of ketogenic diets, like many doctors have been from the Dr. Atkins. He started publishing books in the 1970s. I don't think
Hmm.
I read my first Atkins book until 1992 or so. So that's over 30 years ago.
Yeah.
And I was sold hook, line, and sinker on
Oh,
that
okay.
concept.
Okay.
So I was already a physician when I did that. Now I have always struggled with weight, and even though through high school I played a few sports and I was always active, and but always was probably the or one of the heaviest. I usually there was someone else in the class that was heavier than me, but uh, I was still pretty active,
Hmm.
but always struggling with weight. So I was always trying to lose weight, and my mother also struggled with weight. So from the late 60s, early 70s, I remember She was on Weight Watchers, and whatever she did, I would do with her. And then through the 70s and 80s, there were a bunch of these different, they always involved a shake, right?
Yeah.
Some powder that you mixed with water or milk, and then you added some oils.
Yeah.
So I did several several of those,
Okay.
uh, and other things that you can find the pharmacy, supplements. I mean, anyone who's has struggled with weight probably has done the same thing, right?
Sure. Yep.
And of course, the restricting diet. I think the main problem with, because you can lose weight by trying to go in a low calorie diet,
Right.
uh, but the problem with most low calorie diets is you're always hungry,
Yeah.
and hunger always wins. Is my opinion, right? So,
Yes, it will.
it's easy to tell a patient, "Oh, you have to be in a calorie deficit,"
Right.
but you can sustain that only so long without giving specific instructions. So,
Right.
and since I read the Atkins book, I have used basically that method, uh, going low calorie and not restricting necessarily the meat or
Hmm.
the veggies, and not being. I've never been afraid of the fat either.
Okay.
Uh, it's always more filling.
Right.
You do end up restricting the total amount of energy, but it's out of this feeling satiated
Right.
sense that you
Yeah.
get with low carbohydrate diets, and it is probably a result of the protein and fat in the diet. If you eat predominantly carbohydrates, you're always going to be hungry.
Right. And hangry. You get hangry. You get like very upset when you start getting hungry. Very cranky.
So, uh, back again in 2002, my son was his last year of high school then, and I had another Atkins book that we read. We read it together, and we did it together. He didn't have a lot of weight to lose, but he lost what he wanted to lose, and I
Mm.
again lost about 40 pounds. So
Yeah.
for the past 30 some years, whenever I wanted to lose weight,
Yeah.
uh, I used that method, but like many of us, did not stick with it.
Right.
And of course, that was my mistake. But how did that change my practice of medicine? I've always, I'm a family physician. So nowadays, any family physician that doesn't know how to manage diabetes, it probably
Hmm.
should get another profession, right?
Okay.
Usually, when I graduated from medical school and residency, that we were still in this process of referring every patient with diabetes, but the numbers have become truly, if you look at the numbers, they're truly pandemics.
Right.
Diabetes, obesity, fatty liver,
Hmm.
all these metabolic diseases. And so my first advice for 30 years to my especially diabetic or pre-diabetic diabetic patients is you need to cut the carbs.
Right.
You know, start with the brain, the breads in any
Hmm.
form. It doesn't matter where you are. You call breads different names like
Sure. Fun.
tortillas.
Fun.
It doesn't matter how it is. It's still
Yeah.
bread. Oh, how
Hmm.
about whole wheat bread? Well, it's still bread.
Yeah, exactly. Oh,
Uh,
in Colombia, they have these panaderias that are so good. And I have
and
not bought bread in a long time.
I don't deny that it's bread. That bread is good. I'm not
Yeah,
saying I don't like it, but it's poison to me.
it's right.
I
Me
became
too.
diabetic in the mid 90s.
Mm,
I was I remember on a lunch break in a clinic I was working at, I was walking to the little store across the parking lot, and I was so dizzy.
Oh, wow.
And I said, okay. When I went back, I went to the lab. My friend at the lab, I said, can you check my blood sugar? It
Hmm.
was over 300.
Oh,
Well,
wow.
automatically, that makes you diabetic.
Okay.
Uh, your blood sugar
Automatically.
should never be 300.
Right.
Uh, so myself, the way of me controlling my blood sugars have been ever since definitely stay away. But have I stayed away all the time? No. You know,
Hmm.
I 91, 92, I had hit 320. I've been between 300 and 320 probably up until a couple of years ago.
Oh, wow.
Uh, Diabetes, hypertension 6 years ago, had a stroke. Uh, Probably because of all these things put together. You know,
Sure.
diet, my blood pressure, diabetes.
Hmm.
Wasn't that my diabetes? My hemoglobin A1C, which is what most people are going to understand,
Yeah.
was 7 or so.
Mm. Okay.
It wasn't that bad.
Okay.
So, anyways, fast forward until the end of 22, beginning of 23. I said I got to do something uh, a little bit more strict, and that's when I started my this last journey, and
Hmm.
hopefully the last ever. On I lost about 120 pounds from my heaviest.
Wow.
My A1C is now 5.4.
Okay.
Uh, I am off all blood pressure medication. I was using two of them at very high doses.
Mm.
Um, Along the way, stop using any reflux medications. Uh, I had surgery 37 years ago this month, and I I think in the past year and a half or 2 years, I may have used an anti-inflammatory like ibuprofen or diclofenac 3 times, maybe 4 times.
Yeah.
Uh, Muscle relaxants. You know, I was
Oh,
always
wow.
in pain because seeing patients, you don't want your doctor to be on things like hydrocodone or
Oh,
oxycodone.
yeah. No way. Yeah, exactly.
Not a nice thing. So the only times I have used something like that may have been having
Mm.
had dental work or
Sure.
something like that. But uh, so I am off 7 prescription medications, I
Wow.
believe.
Wow.
Uh, Anyways,
That's amazing. That's amazing.
a few other things like neuropathies. I have 4 different reasons for numbness and tingling in my legs. That
Yeah.
includes diabetic neuropathy, uh, sequela from the stroke, vitamin
Mm.
B12 deficiency, and the back surgery with a pinched nerve back 37 years ago. And even though I still have it, I'm not claiming that that's gone, but it's a lot better. A lot
Hmm.
better. I was to the
That's
point two
amazing.
years ago where I wasn't feeling my feet that much. I had fallen a couple of times at work.
Wow.
Uh, I was over 310 and then trying to bend anyways.
It,
Wasn't feeling
wow.
much my legs. So all that has definitely improved.
Yeah.
Even something that I didn't pay much attention to for a few years. I've had one of my 10 toenails with a little bit of fungus, and
Yeah.
I knew that it was that, but I didn't want to have to take medications orally, and the only topical medications you can use for that, you have to use them 52 consecutive weeks, basically a
Yeah.
full year for it to work. I had consulted with a friend of mine, podiatrist. He said, "Yeah, that look." I sent him a picture, and he said, "Yeah, that looks like fungus."
Yeah.
Well, it's fun.
It's
It
crazy. It's
so
so crazy. And this is
little
from
bit.
going from keto to carnivore or on your keto because you started or yeah, explain.
So so at the beginning of 23,
Yeah.
I I went keto,
Okay.
and over the next 6 months, I was tightening the amount of carbohydrates.
Mm-hmm.
Uh, Lost about 20 pounds probably by April. And then I said, no, I got to be more strict. So between April and June, I lost another 20 pounds or so. Then on June 12th, I went to have my eyes checked, and I had maybe not every year, but regularly done my eye exams over the previous 30 years.
Yeah.
And they were fine. They had been fine until this past 2023 in
Yeah.
June, when I had my eyes checked, and the doctor says, Nelson, you have macular edema. It's
What's
one of the
that?
first swelling of the macula of the eye. The macula
Okay.
is the most sensitive spot in your retina.
Okay.
So whenever there are things that affect the macula, you probably have heard of macular degeneration, for
Yeah.
example.
Sure.
It is the most sensitive spot. So the highest definition camera that you have
Mm,
in your eyes to
yeah.
see.
Okay.
Okay. So when you start having problems at the macula,
Yeah.
that, you know, you can end up having serious visual acuity problems. You go
Okay.
blind.
Oh, oh wow.
And it is something that can happen just with the diabetes. But the
Okay.
only difference in the past 29 years, it was at the time I had been for about a year and a half to 2 years using a GLP-1,
Oh no. Okay. Okay.
like Zempic and the
Yeah.
Victoza. This one was called Trulicity. And it's not exclusive to the Trulicity. This is
Okay.
something, it's a class related
Okay.
known side effect. You can
Oh,
look up
okay.
the information.
Yeah.
And I said, well, I think after that, I had one or two more injections of the Trulicity, and I stopped it
Okay.
because it can be caused by that. And my A1C again, just a month before, had been 6.7. So
Oh wow.
even though I had been doing keto now for about 5 months before I had that A1C, it was still 6.7. Uh, so I said, no, I got to do something more strict. And I started doing a little bit more research. And even though I was peripherally aware that there are some people who only eat meat or animal products, like
Yeah.
at the time, of course, I had heard, who everybody has heard about in this world, at least,
Yeah.
uh, Jordan Peterson, Michaela Peterson, Joe
Right.
Rogan. But to tell you the truth, I had never heard of Dr. Baker or Dr. Chafee or Dr.
Mm.
Barry or Dr. Kiltz, or none of these other doctors that
Yeah.
you can see on YouTube and on the social platforms. Um, and then towards the end of June, I saw Kerry Mann
Mm.
interviewing Sean White.
Okay.
Okay. So I saw that video, and I said, okay, I'm gonna try this. I've always liked meat, and even though in the
Yeah.
past I've been vegetarian and other things, I said, oh, we can try this. So I went for it. Today, by the way,
Yeah.
500 days.
Wow, congratulations.
Days,
Yay.
and about 3 days later, 4 days later, uh, after I started, I got up and I was not hungry.
Oh wow.
It was a sensation of like, you don't need to eat anything today. I
Wow.
Okay, so I didn't eat until the next day. And I think I ate the following day, not because I was really that hungry. It was okay. I did a day, ended up being 48 hours of fasting,
Yeah.
like it was nothing.
Right. That's
So
awesome.
satiation is definitely a very important thing, and why many people who try to lose weight, going on very strict low carbohydrate diet, I mean, calorie diets,
Oh yeah, it's terrible.
sometimes the hunger is still gonna be there even after a while. So it's not that
Yeah.
they're never effective, but
No, I did a
I think it's
very
more sustainable to eat low carb than low calorie.
I like low carb because I don't feel starving and angry all the time. or want to cry at the drop of a hat, or just not feeling like emotionally stable. And low calorie will do that to me, or high carbohydrate will do that to me. I want to say I did a low calorie. Did you ever hear of this HCG diet? Did you ever have patients on that? Okay. I did this in my 20s. I wasn't fat. I was actually thinner than I am now. Um,
Uh,
Much thinner than I am now. So me and my friends, we did this diet. We got these drops at the Texas State Fair. A great place to buy a diet supplement, right? The Texas State Fair. And we did this thing for a month. I got very skinny. So skinny that my boyfriend at the time said, "Where'd your boobs go?" And then my uncle later told me, "You looked so sick." And then directly after that, because I'd been starving myself for 21 days, um, but not fasting, just eating very low calorie with these drops. Um,
so
so I got super fat after that. Like I went way past where I even started.
among the many things I've done in
Yeah.
for years, I used to be in a weight loss clinic.
Oh, okay.
One of the things that we did, besides prescribing some medications, we did
Yeah.
ACE injections.
Oh, okay.
You
They
know,
little stuff.
the diet that yes, the diet that goes along with the ACG, it's a
Yeah.
500 calorie diet.
Oh, yeah. I think that's what we did. I think we did 1,000 calories. Me and my two
So
girlfriends. Maybe we
you
did
definitely
500.
lose weight, but even eating 500 calories a day,
Yeah.
you're gonna hit a wall somewhere. It could be at 20 pounds, 30 pounds, 40 pounds.
Hmm.
There's gonna be a time when your body says, "Wait a second,
Right.
you're losing weight. You're not
Hmm.
nourishing me. I
Right.
need protein. I need fat. Uh, I'm not gonna burn more fat."
Right. Right.
You could be eating 500 calories a day and still not lose weight after a while.
Sure.
And if you lose more weight after that, it's probably gonna be all protein, no muscle.
Oh, okay.
You're
That's
gonna get
terrible.
sick. You're gonna get, so in the long run, it is not a sustainable thing either. Did I do it
Right.
myself? I did it myself. I think I have a notebook with my weights from back then, and I think I lost about 30 pounds, and then the weight loss stopped.
Right.
Other things, this is not, there's a whole story behind me not having hair right now, but
Was asking, but yes, let us
But the
know.
AC, while I was getting the ACG injections, my
Yeah.
hair started to get very thin. I
Oh,
always had
wow.
a lot of hair, and
Yeah.
I don't know if I send you some pictures.
I think I've seen some floating around the internet a little
So,
bit.
as a matter of fact, I shaved my head because of a friend who had cancer, basically.
Oh, that's very
Uh,
nice.
so my hair was pretty long at the time, but when I was using the ACG, my hair started thinning.
Oh, wow.
So it's
Isn't
one of the fat diets.
mhm.
I
Isn't
was
that
working.
like the hormone that shows up on a pregnancy test?
Yes, it's exactly the hormone that you measure when you're trying to see if someone is pregnant now.
So, wouldn't it only naturally be occurring in women? Or no, HGC is growth hormone, so everybody shows that, right? Or has that hormone in the body?
So HCG is human chorionitropic hormone, and
Okay.
you you only produce significant amounts when you're pregnant.
Oh, okay.
That's why you measure it to see if someone's pregnant or not.
Okay.
You will have, I mean, I'm sure there might be some minimal amounts, but you
Yeah.
only produce that when you're pregnant. So
Okay.
that's why it's a fairly listen. You can go to I don't know if you know what Dollar Tree is here because you live down
Sure.
south, but
I'm
you
from
can go
Chicago.
to Dollar Tree and for a dollar
Yeah.
25 buy a pregnancy test is very very accurate. If that thing
Yeah.
says you're pregnant, it's like 99% for
Correct.
sure you're
Yeah.
pregnant. So
Yeah.
so you only produce it in pregnancy, and there are some
So men
studies.
wouldn't really shouldn't really inject it in their bodies then. Probably.
Yeah, there are some studies
Yeah.
that may show a benefit, but I think most of the benefit was because you're also recommending a 500-calorie diet.
Okay. Yeah, exactly.
So I can give you an injection with probably water and give you a 500-calorie diet. You're gonna lose weight.
Yeah, up to a certain point. Yeah, my body was not happy that I did that to it, actually. But in various times in my life, I've done what you've done, like, oh, it's time to do low carb. I should lose some weight. I was even telling my husband about a story when I was 16, I was eating pancakes like every day. And then one day I was like, I need to stop eating pancakes. And just from not eating pancakes for breakfast, I got very skinny. But I was 16. I wasn't in my 40s having had two babies. Do you experience women coming to you with, like, after they've had babies, a very hard time losing weight?
Yes, and so you know that in a woman's lifetime,
Yeah.
there are at least three very distinct periods where you become more insulin resistant.
Okay.
Okay.
Yeah.
Uh, one of them, surprisingly enough, is when you hit puberty.
Okay.
Okay. But the reason for that is we do have this hormonal mechanism to make you grow and gain weight, right?
Yeah.
So, just like bears get ready for the winter, when you're getting ready for puberty, it's a period of some insulin resistance. You're going to be eating more.
Yeah.
Uh, all my three kids hit a growth spurt between 10 and 12
Okay.
to the point that it was, like a huge expense to
Clothes and food.
and one time my father-in-law said, you know what, Nelson, if you ever are not here, meaning if you ever die,
Yeah.
I will be willing to take care of your kids, but your dad is going to pay for the food. That because that's a period. So the
Okay.
second period of insulin resistance is pregnancy.
Okay, for sure.
Okay. And again, you're growing alive. So you
Hmm.
need to put up some fat on your body,
Right.
basically. And
Right.
so insulin plays a role. See, these are normal times of insulin resistance.
Mm.
Why do women get gestational diabetes? Probably because they were already insulin resistant when they
Mm.
got to pregnancy.
Right.
And now that your body is going for an additional measure of insulin resistance, then okay, now it's too much because now you have gestational diabetes.
Right.
And the third time is postmenopausal.
That's crazy. I'm looking forward to that one. No. Yeah.
So
No.
yes, I have women that may have a little bit of more problem losing weight after a pregnancy.
Hmm.
Usually are the people who develop gestational diabetes, for example.
Yeah.
They are already the people that had some if you go back in the history, you kind of uh, can guess, because that's the only thing we can do sometimes, but guess that, okay, they were insulin resistant before pregnancy.
Sure.
Now they put up, 20, 30, 40 pounds, and now they're having a hard time uh, losing that.
Sure.
But
Sure.
still, I think the best approach to lower any problem or get rid of any problems that have to do with insulin levels and insulin resistance is
Yeah.
go on a low carb diet.
Sure. Sure.
You'll eventually be able to do that.
Yeah, exactly. I went on a free for all when I was pregnant with my son and I gained 80 pounds. I just ate whatever I felt like. Bad mistake. And so I'm going to say right now I am like 50 pounds down from my heaviest. So I still have more, that other 30 I would like to get rid of. But I'm happy with how I eat because I'm comfortable eating very low carb, carnivore most days, add some olives a couple times a week. Like, but it helps me. And I hope some other women can. I'm curious, now that since you're a doctor, I'll just ask you my questions as they come to me. So at 14, I started having symptoms of endometriosis. It's never been diagnosed. But I don't know how to explain it once I realized and understood the symptoms of it, that you're not like supposed to be debilitated in bed, like dying for 2 days. Like that's not normal. Do you think that that's connected to insulin resistance, the endometriosis?
Yes.
Okay.
Uh, the pain usually is from inflammation, and I know you're very often in the mornings with Dr. Kiltz in his
Yeah.
morning lives.
I wake
He
up really early.
does explain it there, but just for whoever doesn't know what endometriosis
Oh
is
yeah.
basically tissues from the inside lining of the uterus. Is
Yeah.
that tissue is called the endometrium,
Okay.
and that tissue can basically migrate outside the uterus, and sometimes you have spots of those tissue cells growing outside the uterus into the intestines in the inside cavity. And the worse the endometriosis, the more spread that would be.
And the more painful.
And so it's painful. It's
Yeah.
painful. So, uh, so not all painful periods are because of endometriosis,
Right. Right.
but almost everyone that has endometriosis is going to have very painful periods because it's usually not only inside the uterus, but outside the
Right.
uterus.
Right. Yeah, I would get pain like down to my knees, like pain down to my knees in the butthole, like everywhere. Sorry, it's true. And it would be so, so painful. And one of my friends, like, how you're explaining this is as if you're like going into labor every month. And honestly, I don't know what that is because I had 2 C-sections. So I actually never felt labor pains. So I couldn't agree. I know if what she was saying was true or not, but it calmed down after I had kids. Is that normal?
Yes,
Okay.
it, it it's worse. Usually, there are a couple of things that happen. Uh, the last patient I diagnosed just a few months ago with endometriosis happened to have been someone who was in her 30s
Okay.
and had never had kids. And
Okay.
there are a couple of things that happen in women who never have kids, for example.
Yeah.
Uh, and this has been done because they have studied, for example, nuns.
Oh, okay.
There is more incidence of endometrial cancer
Oh, wow.
in women who have never had kids.
Oh, wow. Oh, wow.
So when you're pregnant, you suppress the growth to a certain
Mm, mhm.
extent of that endometrium. It
Yeah.
doesn't go through the cyclical changes every month because now
Right.
we're sustaining this life that's growing inside
Right.
you.
Right.
And so that decreases the problems with endometriosis. Also, when you have one or more kids, it reduces your risk of endometrial cancer.
Wow. I had no idea. Well, that's very good to know. I will say, so it really calmed down, but I wouldn't say that my menstrual cycle was perfect. And even now I still feel pain. Sometimes I'm down for the count for like an hour, but being on a carnivore way of eating and eating lots of red meat dramatically reduced the amount of inflammation and pain that I did feel. I don't want to say it's perfect, but going from terror, like dreading every 28th day, dreading it, but it wasn't even 28 days. It was like 5 days before 28 days. So every 15 days feeling very terrible. So then
I
now it's basically normal. I had kids, so I attribute it to kids, but also eating a carnivore way of eating. I'm like, sometimes my period just sneaks up on me, and that's a beautiful thing.
when you have very painful periods, whether it's endometriosis or just real bad, just the period itself is
Yeah,
very painful. Most doctors might offer you to be on birth control pills.
right. I was for
Okay,
a little while. I was.
so and the control that that exerts on the endometrium, not letting it grow too much, and then sometimes some women on birth control pills, they don't have periods anymore, or
Right.
if they have the IUD, they might stop their periods. Uh, so it's helpful for pain. Now, it can carry some risk of using just birth control pills,
Sure.
but yeah, the more pregnancies, the less dysmenorrhea is the term, painful periods.
Okay.
Probably will have. Now, in my home, I have a young lady who accuses me of being the cause of her very painful, sometimes painful menstruation, because every month she reminds me, I'm dying and it's your fault.
Sorry, I
Yeah,
shouldn't laugh.
she's not gonna hear this, but my daughter says it's my fault because she's learned that it is the male who determines the sex of the baby.
Oh, and she's saying if she was male, she wouldn't experience the periods.
Well, she wouldn't be having.
This is true. Oh my god. Oh my god. I just want to put a plug in for your daughter. Get her to eat more red meat and stop eating the junk food. It will
Well,
help dramatically.
she'll eat red meat and all kinds of meat, but she's a junketarian. Now,
Yeah.
let me mention this.
Sure.
Back in September, my grandson was 1 year old. We were celebrating his birthday, and it was my turn to buy a bunch of drinks for the people who were going. And of course, you know, very few people there follow
Yeah.
that I do. So I was supposed to buy Coke and Sprite and sugary drink and
Oh god.
a bunch of other diet drinks. So I did buy some sparkling water, and
Okay.
you know what? Those went first for some reason,
Oh wow.
uh, to my amazement. Anyways, we ended
Yeah.
up having a lot of regular Coke and Sprite left,
Yeah.
which we brought home. But the only one who used to drink that was my daughter.
Okay.
And a few weeks ago, a little bit more than a month, I realized they're still here.
Oh
So
wow.
I asked her, and she's no longer drinking
Oh, great.
sugary sodas. She'll
That's
drink the
awesome.
diet. And
Okay.
so, they sometimes, she's not exactly 15 either. She's 29 now. No, I
Oh
do have
man.
one of my sons is pretty much keto, and
Okay.
he likes it.
Okay. That's great. Yeah, my kids, so I live in South America and I live on a big finca with family. We're in separate houses, but we don't have like rice in our house. So when my kids, who are half Latino, even though they look very gringo, When they want rice, they just go to grandma's house, or they go to the aunt's house where there's always rice. Not always, but enough of the time. There's ways to get the stuff they want, but we don't have it in the house because, one, I don't like rice. I hate rice, but and we don't have carbohydrates in the house, and I'm going to thank my husband for that also, because he doesn't like carbohydrates, and I don't have any food that's going to make me want to eat it.
Yeah. I have some rice here, and it's only
Yeah,
because my daughter likes it, and
yeah.
I am not tempted by most foods, I would
Oh,
say,
good.
if all.
Yeah.
At this point, I can usually, when I'm home and let's say she wants rice, even though she can do it, Dad, can you make me some rice? Well, that has been only now once in the past 6 months.
Oh,
Uh,
okay. Nice.
and I do have some. Actually, I don't have any more beans now, but sometimes I
Nice.
make chili. I put beans for them.
Yeah.
Uh, uh, but I'm personally not tempted. One of my biggest vices had been for years apple fritters, right?
Oh, so good.
And so I would go to 7-Eleven, racetrack, gas stations.
Yeah.
And I would get one for me, one for my wife, a second one for maybe me. I sometimes might get home and didn't have any of the three I bought.
Oh,
Uh,
wow.
I look at that now and I see plastic,
Hmm.
synthetic stuff, because that stuff you can leave it outside, it will last months,
Oh,
with
crazy.
no preservatives, right?
Oh, so it's nuts. So gross. But I love them also. I used to eat those a lot. Apple fritters were probably my favorite of the donut family. I want to say, Haramis from Russia says, we watched Dr. Nelson's fascinating interview as Anthony Chapey's guest. Cool. And then Karen says,
For what?
hello. Yeah, thanks for watching. Hello, Alia and Dr. Nelson. If anyone has any questions, please feel free to put them in the chat. And I had
Yeah.
another question, and I totally. Oh, okay. So one of the reasons. So after I had Jacob, he's my son. I was diagnosed with a thyroid condition, and then more recently, I found out that it's actually Hashimoto's. Which now I understand. Like 3 days starting carnivore, like the third day into carnivore, I felt like a different human being. I'm like, oh, I'm not crying anymore. I feel normal again. I feel cheerful again. I can sleep again. Um, do you ever recommend like doing a keto or carnivore diet for women or anyone with Hashimoto's?
Definitely, I have to
Yeah.
say 100% of the time. Now,
Oh, okay.
Hashimoto's disease, and like any other autoimmune problem, they all have one thing in common, right? And it's your own body is attacking your native tissues
Right.
by mistake,
Right.
right?
Right.
They are identifying, in this case, your thyroid as foreign tissue that's not
Right.
supposed to be there, but it is your tissue. So
Right.
the common thing with all of them causing that is basically a process of inflammation. Inflammation is a normal process in the body to rebuild and repair, but sometimes it goes haywire.
Okay.
And uh, the lower, the least inflammatory diet is going to help you with any of those autoimmune issues. Is
Right.
it going to get rid of them? Not necessarily,
I don't.
but
Yeah.
I'm pretty sure it's going to improve a lot. And I know you've been doing this for how long yourself?
March 2023. Of March 2023. Yeah, like a year,
Well,
almost 2 years ago.
that was 3 months before me.
Yeah.
Uh, so you've seen the stories, and a lot of it is anecdotal.
Right.
But when you keep hearing the same anecdote over and over and over, you have to think, okay, there has to be something to this, right?
Right.
So people with psoriasis, psoriatic arthritis, rheumatoid arthritis, systemic lupus, and sometimes just there are some patients that don't have a specific autoimmune disease, but they have
Mhm.
inflammation markers that are
Yeah.
high.
Yeah.
I think it is the most anti-inflammatory diet because if you want to do an experiment and go for 30 days or 90 days on a beef, salt, and water only
Yeah.
uh, diet, you will realize that many of the things you were eating before do harm to you.
Right.
Now, which one it is for you, which one it is for me, I don't I don't think I've ever had any problems with any specific food. Uh, but by doing this, I discovered when I tried to add a little bit of black pepper, for example, didn't sit well with me. When I try
Mm-hmm.
to add a little, I love garlic, so whenever I cook, it's heavy garlic. Well,
Okay.
not anymore.
Oh, wow.
I can have, as a condiment, as a spice on the meat, a little bit of garlic,
Yeah.
but I have to keep it at a minimum,
Okay.
uh, because otherwise it's not gonna sit down good
Yeah.
with my stomach. And there are many other people who discover, oh wow, all these spices, one
Yeah.
or many of them, do cause GI distress or
Yeah.
pain.
Yeah, exactly. Exactly. I love spicy food. I can't do it anymore. I like it in the mouth, but I don't like it affecting the rest of the body. But oh man,
Well,
I love like the sweat when
the
you're eating.
problem is the same irritation that it causes in your mouth,
Yeah.
the whole intestinal tract until it
Mm,
comes out is similar type of tissues, right? So
yeah. And you feel it on the way out generally. But I don't
so
need so much anymore.
yeah, I discovered, for example, I used to like very hot
Yeah.
type of peppers, like I can handle jalapenos pretty good, but I'm forgetting habanero
Habanero?
peppers.
Yeah.
Habanero peppers, for example, s- still like them, still would try it, but they, I realize now they're too much for me.
Yeah.
And if I had too much of it, it's gonna do something.
Oh yeah. It's gonna do something. Not to segue too much, but I was making like chili with habanero, jalapenos, and a whole bunch of other stuff. And I was wearing contacts at the time. And I washed my hands like multiple times after dealing with these peppers. And I burnt my eyes trying to take my contacts out.
I used to make hot sauce,
Yeah.
a couple of types of hot sauces, Puerto Rican style,
Yeah.
just with the whole peppers and a bunch of spices in vinegar and water. And if I dealt with habaneros or something very hot, I would always use gloves.
Okay. Yeah. I learned after that. After that scenario, I literally destroyed like 3 sets of contacts, but I couldn't wear. I waited 3 days before I put my contacts back in. Anyways, okay, Dr. Vasquez, we're almost at an hour here, and here we go. Someone says hello. Hello, Rod. Good morning. Good morning to you. Um, since we're in our last few minutes here, is there anything else you would like to say? And also, if people do you do teledoctoring? What is it called? Telehealth?
Do I do telehealth?
Yeah, do you do
No, I'm
telehealth?
not set up to do that at the moment.
Okay.
For the past couple of years, I've been doing what we call locum tenens in the trade, I guess, which is temporary assignments. So
Oh,
I
okay.
actually I actually just finished in a place I was for 5 or 6 months this past Friday, and
Oh,
tomorrow
okay.
I start in another place closer to
Okay.
home. I won't be staying in hotels.
Oh, that's
Uh,
nice. Are you in Miami?
I am in Central Florida.
Central Florida. Okay. Okay.
very close to Orlando. I'm between Daytona Beach
Okay.
and Orlando.
Okay.
And
So
if
if
you're
people
familiar
in
with the
Florida,
state and the roads, I-4 basically is the I-4 corridor. I'm almost smack in the middle.
okay. So if people want to come and see you in Florida, you're there.
I'm here.
Okay. Next to Disney World, Orlando, or whatever's in Florida.
Yeah, I'm about an hour to because Disney's on the other side of Orlando. It's really
Okay.
south
Yeah.
west, and everybody calls it Orlando, but it's not even Orlando.
Oh,
It-
okay. That's very funny.
It's Lake Buena Vista.
Oh, I didn't know. There you go. So
Almost
is there,
Kissimmee.
yeah. I flew into Orlando last year. So there you go. um so is there anything else you want to say? If people need to reach out to you, or anything else you want to say before you end on the carnivore diet, or anything else?
I am. You can find me at the Real Dr. Nelson on
Oh, great.
YouTube and
Yeah.
most social platforms. I'm not exactly very active on any of them, but subscribe to my channel,
Oh,
like I.
yeah. I'm going to show
Oh,
your channel.
and I
I'm,
was looking for my Healing Humanity shirt to wear it. I know you have been very involved with humanity, and I love
yes.
that project.
Oh, me too. Me too. We're going to help a
So
lot of people.
human Healing Humanity movie and Healing Humanity live. Their
Yes. And
community.
yeah, it's awesome. We are going to do an official launch very soon. I'm just trying to find your YouTube channel. At Real Dr. Nelson.
Yes,
A
and
DR.
no,
Oh, I had. Oh, doctor, like spelt out.
the Real Doctor spelled out.
Okay,
And
let
if
me
you
see.
look at the lives, I am live with you right now on your
Yeah, and
on
I
my
think
channel.
yeah, exactly. And I believe that I put your link down below in the description of this YouTube channel. Let me see really quick here. Sorry about that. I should have had this prepared. Real Dr. Nelson. I'm gonna just hop over to my channel real quick and see if I can find your here we go.
And no S's in my last name.
Oh,
Although
that's why I'm messing it up. Okay.
Nelson is my first name. Vasquez is my last name. So it's Vazquez, like it's on the screen right now.
Yeah, exactly.
But the channel is at the Real Dr. Nelson, spelled out completely.
Okay, good. I will make sure it's in the description. I'm having a hard time finding it right now while trying to also finish the live stream. So I'll make sure it's in the description, and yes, subscribe. What content will we find on your channel?
I mostly have most of the interviews I've had reposted,
Oh,
and
okay.
I make a post. I haven't put up too much content.
Okay. All right. Well, there you go. Go subscribe to the real Dr. Nelson, not the fake one, the real one. And he has 40 years of doctoring, physicianing, family physicianing, which is awesome and much appreciated. And since you love keto and carnivore, that's going to help a lot of people, a lot more people.
Yeah. Stay low carb. Definitely stay low carb.
Yeah. Yeah.
I mean, we can probably list 50 different problems that people have that will get resolved with low carb. Don't be
Yeah.
afraid of fat. Like Dr. Bigman says, prioritize the protein. Don't fear the fat.
Yeah, exactly. Exactly. It's funny because sometimes my daughter will wake up in the middle of the night and she's like, I'm hungry. I'm like, let's go eat some butter because I know she'll go right back to sleep. It's time to eat some butter. I'm not cooking food at 2 a.m.
Now I know we have to go, but I was gonna ask you,
Sure.
are you able to find just fat at your butchers? I
Yeah.
mean,
I do find fat at the butchers. It's really easy. I think it's easier to find stuff in Colombia than it is in the United States. Like I can find all organ meats of the cow, They call the viscera of the chicken, and I usually eat that if I'm eating organ meats over. I've tried cow, I can't, I can't do it, but it's easy to find it. You can find lung, you find liver, you can find fat. It's easy. And one guy was trying, one butcher was trying to cut the fat off. I'm like, leave the fat on the meat, don't take it off. He's like, I know, people are confusing me now. We used to have to cut it off, and now they want it on.
The other day I bought some picanha steaks.
Yeah.
At Bravo supermarkets here in I was in Melbourne, and they had trimmed all the fat of the picanha.
No, it's terrible. It's terrible. Leave the fat on. Here, so if you come to Colombia, picanha is punto de anca, if you ever come to Colombia. Punto de anca. But yeah, luckily you can find the fat on the meat. I love that because it's very annoying when they take it off the meat. Who wants a dry, unfatty steak? Nobody. Okay, cool. Dr. Vazquez, it's been awesome. Thank you so much for taking an hour on your Sunday and hanging out with us. And I want to say thank you to everybody who's been watching and spending your time and in the chat. I also appreciate it because I know it's Sunday afternoon. All right. With that, I'm going to say hasta luego.